Today we're learning about walk-in clinic care versus primary care and when to visit the emergency room. Joining us via Zoom is Luke Wyzlic, a physician assistant with Aspirus Ironwood. Luke, what are the differences between these types of care?
So basically the walk-in clinic is almost like a fast-track ER or a step-down urgent care. And so really what we try to do here is acute care injuries and kind of problems as they arise. So things like sore throats, earaches, ankle sprains, lumps, bumps, things that are very minor injuries. Our walk-in clinic here in Ironwood, and most of them throughout the country, are kind of set up more like almost like a retail clinic or a minute clinic type of thing. So we kind of handle the acute care, type of issues where an ER is probably a little bit more aggressive, in terms of what you need. You probably don't need to go that high in terms of acuity. And so we kind of do the fast track version of almost like an ER. And on the primary care side of things, our colleagues on that side of medicine, they kind of deal with the chronic medical condition management side. So they manage things like hypertension, which is high blood pressure, diabetes, psychiatric, issues, that type of thing, things that require chronic and ongoing care. They are also responsible for managing ER follow-ups, hospital follow-ups, or even walk-in clinic follow-ups, because there's oftentimes where patients come in to see us in the acute care setting, and they may not have an answer that day, right? And especially in the ER side of the thing, because of our EMTALA laws, that's really what we're obligated to do by federal law, right? It's to rule out medical emergencies. So you may not receive an actual diagnosis. And so we kind of rule out the bad stuff even here in the walk-in clinic. And at that point, then we turn to our colleagues in primary care and our subspecialists, and they kind of continue that workup. Like if you need an EGD, like a scope, we're not probably going to do that out of the ER. Or if you injure your shoulder, you need an MRI, again, we're probably not going to order that out of the emergency department. And so that's where our colleagues on that side of healthcare kind of help us out.
What kinds of injuries or illnesses would you use for walk-in and then for the emergency room?
So the walk-in clinic is really a fast track. So it's very minor issues, right? So, if you have a sore throat, you have an earache, you got bit by a deer tick, that kind of thing, that's where we come in the walk-in clinic. The emergency department, if you're having severe chest pain, you have a new onset of a headache that you've never had before, or if you have a history of migraines or headaches and hey, this one feels different, it's a lot more significant. Up here in the UP, we have a lot of people on snowmobiles and four-wheelers. If you have an injury on those types of vehicles, then you definitely want to be seen in the ER. If you're a hunter, you fall out of your tree stand, you go get checked out in the ER, you stick your hand in the snowblower, you have an injury there. We have a lot of that actually, which is kind of surprising. We do see quite a bit of those types of injuries up here. So the ones that are really more involved in terms of, injuries would warrant the ER more so than a fast track like a walk-in clinic.
What is something you think patients should know about the differences in care?
I think the message that we try to get out in the walk-in clinic and the ER is I think people need to have a pretty, at least basic understanding of emergency medicine and acute care. It's its own subspecialty, okay? And so that's what we're good at. I'm good at emergency medicine. I'm good at acute care, those types of interventions and that kind of thing. And so that's really where we are kind of like at our pinnacle versus we kind of get these people that come in and they get frustrated, rightfully so, because they have these chronic ongoing issues that we don't really know how to deal with, because we're not subspecialists, right? And so I think that's kind of what people need to understand is we're really good at the acute care side of things, whereas, you won't get upset with a cardiologist, that can't manage your eczema. Well, it's kind of the same principle here, right? So, and I understand their frustrations. Oftentimes patients don't have anywhere else to go, right? So the ER and walk-in clinic, we're kind of like this access point of healthcare in the United States. And so when we have these increasing backlogs within primary care and subspecialties, and it takes you a month or plus to get in, where do you go? They got to be seen, right? And so we're happy to see them, and we're not trying to turn people away here, but that's where it gets a little bit more frustrating for us as well, because we're just not trained in those types of areas. But again, we're always happy to see people. We do the best job that we can, with the resources that we have.
Thank you, Luke. For more information on this, visit aspirus.org. We'll be back in 3 minutes with more My UP Mornings.